The spinal cord connects the brain with the effectors, muscles and glands, for example. Tracts descend from a number of areas in the brain. The corticospinal tracts arise from the cerebral cortex. First-order fibers are the axons of pyramidal cells which lie in the fifth cortical layer. 1/3 arises from each of the somatomotor areas, primary and secondary, and 1/3 from the parietal lobe. The fibers converge to form the corona radiata and descend through the posterior limb of the internal capsule. In the midbrain, the corticospinal tracts traverse the middle third of the crura cerebri, and in the medulla oblongata they form the pyramids. In the lower medulla, about 2/3 of the fibers decussate to form the lateral corticospinal tract, which descends in the lateral funiculus throughout the length of the spinal cord. The remainder descend on the same side as the anterior corticospinal tract in the anterior funiculus and cross to the opposite side, just before ending in the cervical and upper thoracic regions. Fibers of the lateral corticospinal tract synapse in the lateral part of the anterior horn, important for limb movements. Fibers of the anterior corticospinal tract terminate in the medial part of the anterior horn, important for trunk movements. The corticospinal tracts are particularly important for voluntary, delicate, skilled movements of the distal limbs. Descending as they do through the pyramids of the medulla, they are known as pyramidal tracts. All other descending tracts, such as the rubrospinal, vestibulospinal, tectospinal, and reticulospinal tracts, are extrapyramidal. The rubrospinal tract originates from the cells of the red nucleus of the midbrain. Most fibers decussate as they emerge from the nucleus and descend in the lateral funiculus of the spinal cord to end on interneurons in the anterior horn. The red nucleus receives input from the cerebral and the cerebellar cortex, and the rubrospinal tract forms an indirect yet important link with the spinal cord. The vestibulospinal tracts arise mostly from the lateral vestibular nuclei on the floor of the fourth ventricle. They receive afferent fibers from the inner ear and from the cerebellum. The tracts descend in the anterior funiculus of the spinal cord and terminate in the anterior horn. The tectospinal tracts originate from the superior colliculi of the midbrain and decussate almost immediately to descend in the anterior funiculus. Most terminate on interneurons in the anterior horn of the upper cervical segments. They are important for the visual spinal reflexes, the reflex of turning towards a stimulus. The reticulospinal tracts descend from an area of mixed white and grey matter within the brainstem and spinal cord, called the reticular formation. Fibers from the pons descend on the same side through the anterior funiculus. Most fibers from the medulla cross and descend in the lateral funiculus. The tracts end on interneurons in the medial part of the anterior horn. The extrapyramidal tracts are important for basic voluntary movements, adjusting muscle tone by facilitating or inhibiting the activity of alpha and gamma motor neurons. Confined to the central nervous system, fibers which descend from these higher centers are known as upper motor neurons. Their outflow converges on the anterior horn cells, which form the final common pathway to the muscles. These alpha and gamma motor neurons, whose cell bodies lie in the anterior horns and whose axons traverse the peripheral nerves, are known as lower motor neurons. If pyramidal upper motor neurons are damaged, the ability to perform skilled movement is limited, and the Babinski sign, an upgoing plantar reflex which is normal only during the first year of life, returns. Damage to the upper motor neurons of the extrapyramidal system causes severe paralysis. The gamma motor neurons are released from higher control, and the reflexes become exaggerated, causing spasticity, an abnormal increase in muscle tone. Lower motor neuron damage, seen here in this patient with motor neuron disease, causes loss of both voluntary and reflex muscle action. Interruption of the reflex arc causes loss of muscle tone and wasting, and there may be fasciculation, very obvious here in the muscles of the tongue, due to contraction of individual muscle fibers. Hemisection of the spinal cord results in lower motor neuron signs with flaccid paralysis at the level of the damage on that side, and upper motor neuron signs with spastic paralysis below that level.
What happened to me, I was on a push bike cycling, and this transit van cut in and smashed into the back of me and broke my back, which left me paralysed from the waist down. Lost all function of bowel, bladder, legs, sexual function, sensations all gone.